It's very hard. It's very hard. I wish we could afford to go to the dentist like everybody else.
It is a major crisis that's impacting our communities in a very negative and adverse way.
What we have now does not work.
The problem of oral health in the state is much more serious than most people understand or are aware of, I think.
There are very few dentists in New Mexico. Roughly half to two-thirds of the population of the state has very limited access to oral health care.
The fact that we don't have enough dental services and at this point have no hope of actually attaining those needed services in the foreseeable future means that we have a terrible crisis in the state. Something that's interesting is that the scientific literature has now clearly shown that chronic gingivitis and tooth infection has a great deal to do with coronary artery disease, diseases of the pancreas, bladder, prostate. It's quite clear that having chronic bad mouth and bad teeth totally affects other parts of your body and health.
I have a tooth cracked in half and the bottom part of a molar has fallen off. The infection has traveled up into my upper jaw and the infection is actually behind my eardrum. I can't hear anything but ringing out of it. But honestly, I don't have $200. Not for that. It is overwhelming and I don't see a way out. I honestly don't.
People suffer terribly, go without or often end up in the emergency department just to get a little bit of antibiotic and some pain medicine.
Patients come in with complaints of months of this pain that they've been dealing with, and then they're coming in now clearly looking very ill, serious infections that go much, much deeper than their gum line and their teeth line, and that require surgery, an emergency surgery, and very costly and very painful and very long therapy.
That's not the way to manage health in any population. The way to do that is, again, prevention and education and offering people important services earlier in the game than just waiting for an emergency.
We know one solution that works, and that's dental health aid therapists. Alaska has shown that. The solution is to identify people from the communities, get them trained, and have them provide basic dentistry to the people they grew up with in their own communities. We know that works.
I was very skeptical on how anybody could have 2 years of training out of high school and be a qualified dental therapist. I was asked if I would be interested in going to Alaska to learn about it, and I accepted that and did that.
When people come up, they see our program, they see what we're doing with our training, they see the therapist working in the communities, they talk to the patients, they learn about it, and their minds change. And they begin to see that, maybe this isn't such a big scary thing after all. Maybe this isn't a bad idea.
They were basically practicing perfect textbook dentistry. And of course, the textbooks are the same textbooks that are used in dental school. And for the training procedures, the thing is, they just aren't trained in as many procedures as a dentist. But what they do is absolutely superb.
When I first heard about the dental therapy program, some of the questions I had was the training and the education that dental therapists would receive and the quality of education. But when I went up to Alaska, I was able to look at that, and look at the curriculum, the training, and I was very satisfied.
Dental therapists provide basic dental services. They'll take the drill and they'll drill out the decay and they'll fill it. They can do routine extractions, take out teeth that are infected and have a problem. They can also provide preventive services, education, all of those kind of things are part of what a dental therapist does.
The treatment that I saw rendered was absolutely perfection. I would have no hesitation in having a dental health aid therapist do a restoration in my own mouth.
The dental therapist model is, in my opinion, at this point, the only viable option I see.
What we've done in other areas here in the state with great success has been to develop people who could take on some of the capabilities of the full-fledged health professional. So just some examples here in New Mexico are licensed midwives, nurse midwives, physician assistants, nurse practitioners, nurse specialists, nurse anesthetists, paramedics with expanded practice, pharmacists, clinicians, prescribing psychologists.
So we need to have additional providers, and I see the Dental Therapist Project as being a way that we can really have the opportunity to increase those who might have the most impact in terms of our children and in terms of the elderly.
They know the culture, the traditions, the language. So they're going to have an inside track in terms of quality of care and provide something relative to what we have now, where people are itinerant. They come in, they're there maybe for a year, and they're gone. You never are able to establish a real relationship with that provider. So if we can train our own people, they can stay, they become role models for the community, they invest in the community. I mean, all the things that we all want when we come from a community.
If I had a dental health aid therapist in my practice, it would free me up to do the complicated surgeries that I do, the bony impacted wisdom teeth, the cyst removals, the fractures. And a dental health aid therapist would be able to do the simple restorations and the simple extractions.
We're not starting from scratch here in New Mexico. Dental therapists are used in a number of other states in the country and actually around the world. So it's easy then to use models of regulation and law that have already been developed successfully in other places.
There's a problem, there's a solution, and it worked in Alaska. If Alaska natives are smart enough to exercise this option, we should be smart enough to do the same.
So what else are we to do? Because the existing set of circumstances is totally unacceptable, resulting in tremendous suffering and pain and difficulty and medical problems and expense to our current healthcare system. There'd be no doubt that the existing practices, as they incorporated dental therapists, would be able to see more patients every day. And that's really kind of what it boils down to. And there would be more people on the front lines of providing education and prevention. This is a solution that's tried and true, working around the world, and it parallels the other solutions we put into place with the other kinds of practitioners here in New Mexico.